The integumentary system. So the system consists of the skin, the hair, nails, and any appendages that are related to those structures. So first we have the skin. The skin is our body's largest and heaviest organ. It composes of 15% of our body weight, and it is our first layer of defense, meaning it's what keeps things out and keeps the rest of us in. So it's a layer of defense. It protects us from things like bacteria, but it also is really vulnerable because it takes the most beating of any organ in our body. So because it's outside, it's exposed to radiation. It can get a lot of trauma because we bump into things. You can cut it, you can scrape it. If we fall, the first thing that takes the impact is going to be the skin. It's vulnerable to infections because we can get cuts in it. Bacteria can get in it. We can get fungal infections from things getting on our skin. And then chemicals can also affect our skin because if we touch a chemical, it's going to affect our skin, not deeper inside. So we get more treatment than any other organ on our body in our skin. Our skin usually needs the most work. And the study of taking care of the skin or studying the skin is dermatology. So a dermatologist is a doctor that takes care of skin, hair, nails, and anything related to those features. So because the skin is the outermost portion of our body and the biggest organ, it has a lot of really important functions. So its main thing, the biggest thing, is resistance to trauma and infection. So our skin keeps everything inside and keeps the outside, right? So it can resist infection really well by not allowing things to get in. So when you have a cut in your skin, you're more prone to bacteria because the bacteria is able to get into your blood supply. The skin keeps it out. So it protects from infection and also protects from trauma. It works as like a shock absorber and padding to protect our organs and our bones and everything inside. It has other barrier functions, so it can act as a barrier from water. Our skin doesn't let water get into our body, and we don't blow up like a swollen gummy bear in water. Like the water stays out, our skin keeps it out. It protects us from UV radiation, so we're not frying our organs in the sunlight. It protects us from harmful chemicals. They can't get into our organs and our blood supply because they got to get through the skin first. The skin carries out the first step in vitamin D synthesis, so the creation of vitamin D, which is really important for teeth and bones and a lot of other processes in our body. The skin starts it, and the liver and kidneys finish it. Sensation. So the skin is a huge sense organ. We can sense pain, pressure, and temperature in our skin. So all of the pain receptors for those things are in our skin. Thermoregulation is the ability to maintain our temperature internally. So our skin helps us either get warmer or cool off if we're too hot or too cold. And it does this through vasoconstriction and vasodilation. So the blood vessels in our skin can either constrict or dilate to increase or decrease blood supply to the area to warm us or cool us. And then we also sweat. We can also perspirate to cool our body off. And then there's nonverbal communication that our skin can do. So facial expression and self-image are really, really big aspects of skin. We can make faces and smile and stuff because our skin moves from the muscles underneath them. So these are some of the main functions of skin. Skin doesn't seem like the most important organ system, but has a huge role in keeping our bodies healthy. The skin is composed of 3 main layers: the epidermis, the dermis, and the hypodermis. And the hypodermis is also sometimes referred to as the subcutaneous layer. So epidermis means like above the dermis. Dermis is just the name of the dermis. And hypo means below or less than. So the hypodermis is below the dermis. So the outermost layer of the skin is the epidermis. This is the one that you can touch and see. It's made of keratinized or hardened, stratified squamous epithelium. So stratified, meaning it's stacked, and squamous are the thin, flat, scaly cells. This includes the dead cells at the skin surface packed with tough keratin protein. So it's tough and it has keratin. It's hardened because this is the protective layer. This layer needs to be able to take a beating and not fall apart. It's avascular, meaning it has no blood vessels in it. Again, so it can slough off. If you get a scrape, if you brush something, you're not bleeding everywhere. And it's dependent on the diffusion of nutrients from underlying connective tissue. So the tissue underneath this is what supplies it with its nutrients for it to keep growing and stay healthy. and it contains many nerve endings for touch and pain. So we can feel touch, temperature, and pain all on our epidermis because it's our outermost layer. So the epidermis has 4 or 5 layers. 4 layers for thin skin and 5 for thick. So starting from the innermost or the bottom layer closest to your bone is the stratum basale. Basal or basale, anything with that term in it refers to basement. So it's going to be the bottommost. This would be the deepest layer. And then you have the stratum spinosum, second. The stratum granulosum is the third. The stratum lucidum, and this one is only in thick skin. So if we're talking about thick skin, this would be the 4th layer from the bottom up. But if we're talking about thin skin, this layer doesn't exist. And then the top layer, the one that we can touch and see, is the stratum corneum. This is the surface of your skin. And this is made of several layers of dead keratinized cells. Okay, this helps it resist abrasions, water penetration, water loss, and penetration of other things, like getting poked with something. So this layer is the one that has all of the resistance to injury, and it's really resilient because it's made of all those dead cells. So if it gets hit or beat, it doesn't really affect it. The second layer of the skin is the dermis. So this is 0.2 millimeters to 4 millimeters thick. So it can really vary in how thick it is. It's going to be thinnest in your eyelids and thicker on your palms and your soles of your feet, because these are the areas that are going to take a lot of impact, basically. You walk on your feet all day, you grab things with your hands all day. So they're going to be a lot thicker for protection and padding. It's the thickest layer of skin. It's mainly made of collagen. It has many, many blood vessels in it, so it's really vascular. It also has a lot of sweat glands, sebaceous glands, and nerve endings. So it has sweat glands and sebaceous glands. This is the layer that produces your sweat, and sebaceous is oils. And then there's many nerve endings. So when you hurt your skin, it's going to hurt worse when you cut down to the dermal layer. The hair follicles and nail roots are in this layer. The muscles of facial expression attach to this layer. So when we move to make faces, we're moving the dermis and the epidermis because the muscles are attached to the dermal layer. There is a wavy, conspicuous boundary between the dermis and epidermis. And if you look at this picture, you can see they look like little finger-like projections waving up and down. That's the layer between epidermis and dermis. The dermal papillae are the upward finger-like extensions, and the epidermal ridges are the downward waves. So the ones that stick up into the epidermis are the papillae, and then the waves that go down, the softer waves, those are the epidermal ridges. So a little simpler than the 5-layered epidermis, the dermis only has 2 layers, the papillary and the reticular. So the papillary layer is a thin zone of areolar tissue in and near the dermal papillae, which is those finger-like projections that stick up. So areolar tissue is connective tissue, and this is important because this is what provides the nutrition and the cushion for this layer. This layer allows for mobility of white blood cells or leukocytes and other defense cells, and white blood cells are the blood cells that are of our immune system. They're the ones that fight bacteria. So this allows them to move into the skin, and this area has tons of blood vessels. It's very, very vascular. The reticular layer is the thick layer of dense, irregular connective tissue. So it's really thick, weird-shaped connective tissue. This is the bottom, the more bottom layer of the dermis. And when you have stretch marks, this is the layer that is affected by them. So that's why you can't just put like creams on the top of your skin to heal them, because it's deeper in the skin. It's not on the surface. And stretch marks are actually tears in the fibers in this area of the skin. So it's not just stretching. It's literally tearing of the fibers, and you can't just repair them with some kind of special cream. So the bottom layer, or the deepest layer of the skin, is the hypodermis. A lot of times this is referred to as the subcutaneous or sub-Q layer. This contains more areolar and fat or adipose tissue than the dermis. So it has more of that connective tissue than the dermis, and it has lots and lots of fat. It pads the body. So this is our cushion layer, our protection layer, and it binds to underlying tissues. And the underlying tissues are going to be your muscles or your bones or your ligaments. So this fat is going to cover them and coat them for protection. and then it kind of attaches them to the dermis. Basically, it's like the attachment point from the underlying tissues to your skin. Subcutaneous fat refers to the fat that is in this area. And if you look in this picture, it's these orange little globs all over. That's the fat. This works as an energy reservoir, so it can hold energy. It's a thermal insulator, so it can keep heat in. And it's thicker in women. And then, like, women have more than men. And in infants and elderly, it's very thin. So babies don't regulate their temperature well. And as you age, you lose some of that fat. So elderly don't regulate their temperature well. Skin color. So skin color is caused by something called melanin. Melanin is the most significant factor in skin color, and it's produced by melanocytes, which accumulate in the keratinocytes. So the melanocytes are only in parts of skin that have keratin cells. Two forms of the pigment. There's eumelanin, which causes a brownish or black color, and then there's pheomelanin, which causes a reddish or yellow color. So everybody has melanin. It just depends on how much is active and which form of the pigment you have, and that gives you your skin color. So contrary to popular belief, people that have light skin and people that have dark skin have the same amount of melanocytes or melanin cells. Somebody that has darker skin does not have more color cells. The thing that's different is that they have more activated cells. So darker skins, the melanocytes or the melanin cells produce greater quantities of melanin. The melanin breaks down much more slowly, so it lasts a long time. And the granules are more spread out within the cells of the skin. And they can be seen through the epidermis. In lighter skin, the melanin is clumped near the nucleus of the keratinocyte or the skin cell. So it's not as close to the surface, so it's not as easily seen. And then there's little melanin beyond the actual bottom layer of the epidermis. So darker skinned people don't have more color cells. They have more color in the cells, and it's more activated. So what happens when we tan? So UV light exposure stimulates or activates melanin secretion and darkens your skin. So it makes the melanin in those cells that you have more active. It makes it secrete more. The color will eventually fade because the melanin will be degraded and the old cells are going to be exfoliated off. So our skin is always peeling off and sloughing off the old dead skin. So eventually the ones that are nice and tan, the ones that have all the melanin, are going to come off. So as time goes on, it will fade away. It won't stay dark forever. There are other pigments that can influence skin color. Hemoglobin, which is iron found in your blood. It gives your red blood cells a red pigment. This can give your skin a reddish or a pinkish tint. Carotene, which is found in egg yolks and yellow and orange vegetables like carrots. This can give you a yellowish pigment in your skin. And this usually happens in the bottom layer of the stratum corneum, or it happens in the subcutaneous fat. So it's like deep, deep in. So what you do see is very, very faint yellow, not like your whole body is yellow. It's very faint. So what happens if somebody is the wrong color or yellow or something doesn't look right? So there are a bunch of colors that can indicate a medical complication or a medical condition happening in somebody. And this person did not have too much carotene. This person is jaundiced. So some of the colors that are of importance for diagnostics are blue, which is called cyanosis. So usually this is because of oxygen deficiency. Usually the lips and the fingertips turn blue first, and then the rest of the body starts getting a blue tint. Erythema is redness. It's usually associated with infection or swelling or trauma to an area. It's caused because when something happens and an area gets cut or injured, blood's going to rush to that area, and it's going to make it look red because of that hemoglobin in the blood. Pallor is paleness. So a lot of people get pale when they don't feel well. They're getting decreased blood flow. They're sick. They're fighting an infection. That's going to be pallor. Albinism is when somebody's albino. So they have white skin because they completely lack melanin. So they don't have the pigment producing part, so they don't produce any pigment. And jaundice is what this yellow person is here. This is when you have yellowing of the skin because your bilirubin is really, really high. And this can be caused by liver, pancreas, or gallbladder issues. Hematoma is a bruise. So the fancy name for a bruise is a hematoma. It just means that you had trauma to an area and the tiny blood vessels in that area called capillaries busted from the trauma, and there's blood pooling in that area. Not a lot, just a little bit. And we all know that bruises fade over time, but the real term, the medical term for bruising is a hematoma. So we talked about skin, the parts of the skin, and colors of the skin. So let's talk about markings of the skin. So everybody knows that we have markings on our skin. You can have birthmarks, you can have moles, you can have freckles. These are all markings. But there are also markings that are texture markings. So first we have friction ridges, and these are the ridges in your fingerprints. Okay, so if you look at your fingerprints, you're going to have little ridges. Even though they're tiny and you don't really feel the ridges, there are definitely ridges there. So everybody has a unique ridge pattern on your finger or a unique fingerprint. They develop during the growing of the fetus, and they stay there forever, your whole life, and they never change. The only time they would ever be different is if you get a scar or you slice something, but the actual ridges will still be the same. They'll just have like a line through them or a chunk missing from whatever injury happened to your fingertip. Not even identical twins have identical fingerprints. So fingerprints are very, very unique, even more so than DNA. And they also, these little ridges in our fingers allow for manipulation or grabbing of small things. So if our fingers are really flat and smooth, things would slide off them really easy. So because we have these little ridges, it kind of gives us some grip. Then we have flexion lines in our skin. So flexion lines are lines that are found on flexor surfaces. So any surface that flexes, meaning it bends and like contracts. So you can bend it and then unbend it. Like a finger or like your arm. Your elbows, those are flexor surfaces. So we have lines on them. And if you look at your elbows, your knuckles, your wrist, you can see that we have lines in our skin there. And even if you have it extended completely, the lines are still there. So these are the flexor lines. They mark sites where skin folds. And the skin in these is bound to deeper tissues, and which is why the lines are pretty deep. Like it's being pulled down into those deeper tissues. So some of the more obvious skin markings are freckles and moles. So freckles are flat, melanized patches. So it's a patch where a whole bunch of melanin is like piled together. They are flat and they usually have no complications, don't have any issues. They're just there and it's a pigment. Moles are elevated and they're melanized patches, often with hair. So they're raised and there's still a clump of melanin and they have hair in them. Moles can be a problem. They can be cancerous or they could become cancerous. So you should always watch for a change in a mole. If it changes shape, color, size, anything like that, you might want to get it checked out because moles can become cancerous. Hemangiomas, these are birthmarks. These are those red birthmarks that often you see on babies' faces, and they're kind of raised. They're patches of discolored skin caused by benign tumors of dermal capillaries. So what that means is it is a benign or an uncancerous or a non-cancerous, non-harming tumor. Okay, so benign means it's not doing any damage. It's just there to be there. It's not hurting anything. So it's a benign tumor of dermal capillaries, meaning it's small blood vessels in the dermis layer of the skin. So it's a tumor of capillaries in the dermal layer of the skin. Doesn't cause any problems. It just shows as a birthmark. Some of these can disappear in childhood, and others can last forever, and they have to be laser removed. They can spread across different portions of the body as babies grow. They look bigger. They can darken. They can lighten. There's a lot of dermatologists that can use lasers and lighten them completely or remove them. But they are usually full of capillaries, so they kind of have their own blood flow. And they're also referred to as port wine stains. And they're really, really common in infants. If you look at baby's face and they have like red patches, not like redness, but like red clumps or patches, that's usually a hemangioma. So another part of the integumentary system is hair and nails. So hair, nails, and cutaneous glands are accessories of the skin. Okay, so they're extra parts that work with the skin. Hair and nails are composed of mostly dead keratinized cells, so dead hardened cells. Pliable soft keratin makes up the stratum corneum of the skin, and compact hard keratin makes up hair and nails. So it's hard and really tightly packed. It's tougher and more compact due to the numerous cross linkages between these keratin molecules. So there's way more, and they're crossed and linked together, so they're really, really tightly compact. So it's stronger. It can hold up to a lot more damage or abuse than the stratum corneum can. Hair's scientific or medical term is pilus. It is a slender filament of keratinized cells growing from a tube in the skin called a hair follicle. And everybody should know that your hair grows from the scalp out, not from the bottom. So it grows from the hair follicle in the skin. Hair covers the majority of our body except for the palms, the soles of the feet, the palmar, the plantar, and lateral surfaces, and distal segments of fingers and toes. So the undersides of your fingers and toes, and it doesn't cover your lips, your nipples, and certain parts of the genitals. Everything else pretty much has hair. Some people have more hair than others, especially men. Men tend to have a lot more hair because of testosterone causes hair production. Your limbs and trunk have 55 to 70 hairs per centimeter squared, and your face has about 10 times as many. So even if you don't have a beard or a mustache, we all have this peach fuzz all over our face. And that's that hair, that 10 times as many as our limbs. 100,000 hairs on average are on everybody's scalp, unless you're bald. Then you don't have any. Differences in hair across individuals is mainly due to difference in textures and pigment of hair. So the different types of hair are mainly texture and pigment. So you can be a blonde, a brunette, a redhead, and you can have straight, curly, wavy, frizzy, all those different kinds of hairs. That's where it gives that diversity and that just the variations in the hairs. Along with having variations in hair color and hair texture, there's also different types of hair. So in the different types of hair usually go along with different stages in life. So we have lanugo, vellus, and terminal. First we have lanugo, and this is fine, unpigmented hair that appears on a fetus in the last 3 months of development. So when it's still in utero, it has this really, really clear, unpigmented hair all over its body, and it usually protects it from water. It keeps the skin, it gives the skin like a protection from water because the baby's always in the amniotic fluid and it's constantly wet. This is lanugo. Later on, after the baby is born, or right before the baby is born, that lanugo turns into vellus, which is fine hair. It's still very, very pale, but it has some color. And this is what lasts through childhood. So about 2/3 of the hair in women and 1/10 of the hair in men is still vellus. And then all hair on children except for eyebrows, eyelashes, and scalp hair is vellus. So all of the hair on any part of their body is still going to be vellus. As they get older, then you get your terminal hair. This is longer, coarser, and more heavily pigmented. And also in children, it makes up their eyebrows, eyelashes, and the hair of the scalp. But on your body, as you get older, your hair becomes terminal. So it's darker, thicker. After puberty, you start getting axillary and pubic hair, so armpit hair and pubic hair. And then men also get facial hair, and they also get extra hair on their trunk and limbs. So chest hair, back hair, arm hair, leg hair, all that comes after puberty. And that's terminal hair. Hair have receptors, so they don't just grow. They actually have receptors that can sense things. They also have piloerector muscles or erector pili, which causes the hair to stand up. And it's a smooth muscle that attaches follicles to the dermis. It contracts and makes hair stand up. This is what goosebump is. So it's that erector pili muscle contracting because of some response, either a chill or a tickle or a sensation on the skin causes that muscle to activate, contract, and the hair stands up, or you get goosebumps, or you get like a chill and then you look at your arms and you have goosebumps. That's the erector pili muscle. So hair is different shapes based on the color and texture. So somebody that has straight hair is going to have a nice round shape to their hair. Their strands are going to be nice and round. Somebody with wavy hair is going to have oval, and somebody with curly hair is going to be relatively flat. Color can also change this too. So it's going to be different pigments in the cortex cells. So the cortex is going to be like the main part of the hair. Those cells have different pigments in it, and that's what causes hair color. So brown and black hair is going to be rich in eumelanin, just like skin. Red hair is going to be a high concentration of pheomelanin, just like skin. Remember, that gives a reddish, yellowish hint. Blonde hair has an intermediate amount of pheomelanin and very little eumelanin. So it's lighter than red hair because it has less. Gray and white hair lack all melanin. It's faded out. The cells have died. They're not being replaced. It's, the hairs fell out and those melanin cells went with it and they haven't came back. That usually happens as people age over time. Obviously, you get gray hair as you get older. And then there's also air present inside the middle portion of the hair cell. So there is no color and there's nothing else for it to reflect off because it's just open air. So how does our hair grow? So your hair grows 1 millimeter every 3 days or 1/3 of a millimeter per day. So if you think about it, it's kind of fast. Although sometimes we cut our hair and it feels like it takes forever to grow back. It feels slow, but it really is pretty fast. Your hair is always growing. And it's growing in one of 3 stages. There's the anagen stage, the catagen stage, and the telogen stage. So the anagen stage is the actual growth stage. Your hair is growing, cells are multiplying through mitosis, and it's just growing and growing and growing. This is about 90% of the hair on your head. It's doing this. Catagen is the degeneration stage. So this is when the mitosis stops and the hair stops growing, and the root detaches from the blood supply. And if you look in these pictures here, there is this little red blood supply attaching to the root of the hair that's going to detach. When the blood supply detaches, there's no more nutrients, mitosis stops. It's not going to divide. It's not going to make any more because there's no supply. At this point, because there is no root attached, the hair can easily be pulled out by brushing, or if it gets tangled on a clip or something, you can easily pull the hair out. And then the telogen stage is the resting stage. There's nothing happening here. The hair is just chill and resting. We talked about hair growth, so let's talk about hair loss. So every day we lose 50 to 100, on average, hairs out of our scalp. The hair may fall out during catagen or telogen because the root is not attached anymore, or it could be pushed out by a new hair growing in during the anagen phase. So if a new hair starts growing in where an existing hair is that doesn't have a root, that new hair is going to push it out because it's not attached by a root and it will fall out. Alopecia is the actual proper term for balding or baldness, and that's when you're losing all of your hair. And then there's pattern baldness. This is when you're losing hair from a certain part of your head. That Krusty the Clown haircut where you have the sides and the middle hair and then there's no hair in between. That's pattern baldness. So just select regions are losing its hair. And the baldness allele or the baldness gene is dominant in males and it's expressed when testosterone levels are really high. Testosterone causes that terminal hair to fall out and be replaced by vellus. So the terminal hair is that thick, coarse, pigmented hair. It will fall out, and then vellus, or that thin, fine, childlike hair with less pigment, will grow back in. So if you guys look at somebody that is going bald and they have hair right in the middle and it's really, really thin and lighter colored, that's why, because it's a different type of hair. And then you can have hirsutism, which is an excessive or undesirable hairiness in an area that's not usually hairy. So some people have a patch of hair on the side of their neck or on their forehead. That's hirsutism. That's excessive hairiness. So alopecia is baldness. Pattern baldness is when you're spotty going bald. And hirsutism is when you have excess hair in an area that usually is not hairy. So sometimes it's common that people have it on their palms or their forehead. So besides being there and being able to be pretty or causing us a nightmare because we're having bad hair days, hair actually has a function. It has many important functions. So depending on the part of the body the hair is on, it dictates what the function of the hair is. So hair receptors all over our body alert us of parasites or something crawling on the skin. Have you ever felt like you had ants crawling on you or something and you look down, you're fine, but your hair, the little erector pili are contracting and it's saying, hey, I have something on me. So it alerts us if something is crawling on our skin. Hair on your trunk and your limbs is mostly vestigial. And what that means is it used to be important, way back when, before evolution, before we evolved to what we are now. But it's not really important anymore, so it's kind of useless. But it was believed that it kept our ancestors warm back when we were cavemen and stuff. So it's just vestigial, meaning we used it at one point in time, but as evolution happened, it's no longer necessary. There are other parts of our body that are important for this, like our appendix. Vestigial, it used to be important. doesn't matter now. Don't need it. You can totally live without it. Just causes problems. So that's hair on your trunk and your limbs. It's vestigial. Your scalp hair. Scalp hair is really important in keeping your temperature. So if you go out anywhere where there's snow or it's really cold, everybody will urge you to wear a hat because you lose a ton of heat through your head. Your hair will help insulate your scalp and retain that heat in cold environments. It also protects against sunburn. The top of your head is the closest thing to the sun, and if you don't protect it, it will get sunburned. So bald people tend to get sunburn on the top of their head, so you'll see them lathering it with sunscreen because it sunburns really easy, especially if it's shiny. Pubic and axillary hair. So pubic and armpit hair. Axillary means armpit. These signify sexual maturity and aid in the transmission of sexual scents. It's believed that we release scents that are called pheromones. They're sexual scents. We're humans, so we don't really attract mates by sexual scents like animals do. So it's probably also vestigial kind of in a sense because nobody really cares about that. You have guard hairs, and these are hairs that guard things from getting in places. So you have guard hairs in your nostrils and your ear canals, and this keeps debris from getting in your nose or your ears because we don't want things getting in there. If it gets in your nose, it's getting in your respiratory tract. If it gets in your ears, it's going to clog it up, and then you have problems hearing, problems with balance. So we have hair in there that keeps things out. And then we have eyelashes and eyebrows, and these are really important for keeping things out of our eyes. And then they're also really important for nonverbal communication. At least the eyebrows are. So the eyelashes, when we blink, the eyelashes protect the eye. If something's getting in our eye, they usually catch our eyelash before they actually get in the eyeball. So it keeps things out. You can blink and kind of catch things. And the eyebrows keep sweat from coming down your forehead and getting into your eyes. So they have both guard hair jobs, and then they also, when we make faces and stuff, we move our eyebrows, and it helps with nonverbal communication. Now we're on to nails. So you have fingernails and toenails. They are clear, hard derivatives of the stratum corneum. So they are part of the skin, but they're a hard, dead cell packed part of the skin. The function of the nails is for improvement in grooming. So you can pick at things and grab things better with your nails. It probably was really, really beneficial back in caveman days, the way monkeys pick bugs off themselves. Cavemen probably did that. We can pick food apart better, and we can manipulate things better with a nail. And I'm talking regular size nails, not when you go get your nails done and they're 2 inches long. Then you really don't manipulate things well at all, right? So regular nails allow for you to pick up easier things. I haven't had nails most of my life, and then when I had braces, I had nails. And it was insane how many other things I could pick open and pull apart just because I had nails. So it definitely improves your ability to manipulate little things. It provides a counterforce to enhance sensitivity of fleshy fingertips. So our fingertips are really soft and squishy. And when we push on things, they just squish in. But the fingernail provides a counterforce on the other side to improve our sensitivity. Without that, our fingers would be way more squishier and we wouldn't feel as well. So the important parts of the nail, you have the nail plate. This is the hard part of the nail. This is the whole nail. Okay, and then within that nail plate, there are certain little parts. So you have the free edge, and this is the overhang. So usually the part that looks white in the picture. And then when you flip your fingers over and looking at the palm of your hand, the part you can see hanging over, that's your free edge. The nail body is the visible attached part of the nail. So the main part. And then the nail root is the part that goes up under your cuticle, under your skin. So glands are also part of the integumentary system to an extent, just the glands in the skin. So we have sweat glands and sebaceous glands. So let's talk about sweat glands first. So we have two kinds of sweat glands. We have apocrine and eccrine, or merocrine. Eccrine and merocrine mean the same thing. So apocrine sweat glands are the ones that are inactive until puberty. So these are the ones that produce body odor and things like that, things that kids don't have. So they're located in your groin, your anal region, your axilla, which is your armpit, your areola, which is around the breast or the nipple, in the beard area in men. These ducts lead to hair follicles. Okay, so if you look at this picture, you can see the duct right here, this big gooey thing, and it's connecting right to a hair follicle. So the duct is going to lead to a hair follicle. It's going to produce milky sweat that contains fatty acids, and it's going to respond to stress and sexual stimulation. And this is where they think those pheromones come from, that they say the pubic hair helps send out the scent. And it's chemicals that can influence behavior of others, specifically sexual behaviors. Like animals, when they're mating, they let out a scent. We let out pheromones, which are like our scent. But these can let out those kind of scents. And it usually goes into a hair follicle, and it's sent out that way. So the eccrine sweat glands are ones that do not connect to a hair follicle. These are most numerous in adults. They're all over your palms, your soles of your feet, and your forehead. And they have watery perspiration that helps cool the body. So these are the ones that actually produce the sweat on the palms, the feet, and the forehead. And it's usually the non-smelly sweat, whereas the ones from your armpits and stuff is the smelly sweat. The myoepithelial cells, these are found both in apocrine and eccrine glands. They contract in response to stimulation by the nervous system, and they squeeze perspiration up the duct. So these are the cells that when you get really, really nervous, your palms get sweaty. These are myoepithelial cells, and myo means muscle. So myoepithelial will be like muscle skin cells. Okay, and these are in both types of glands. And when you have a sympathetic nervous system response, so you get like nervous or you don't feel well, you're getting shaky, it can trigger these to perspirate, or sweat can come out. And this can cause the sweaty hands, the sweaty feet. Like when people are getting married, they get cold feet. It's usually because they're getting the perspiration because they're nervous and they're having a nervous response to it. So sweat glands release sweat. But what is sweat actually? So sweat is 99% water. Okay, it has a pH of 4 to 6, meaning it is slightly acidic, not very acidic, but it's still acidic. And it's acidic because it keeps bacteria from growing in it. If it was neutral, it's wet, it's warm, and a lot of sweat is in dark areas, like in your groin or in your armpits. Those areas are dark. It's going to be wet and it's going to be warm. It would be a breeding ground for bacteria. Bacteria love warm, dark, wet places. So sweat is slightly acidic because if not, bacteria would love it and it would grow all over the place. Some drugs are excreted in sweat. So certain drugs that you take will come out in your sweat. And sweat's main function, it comes out when we're hot most of the time. Sometimes when we're nervous, but it's usually because we're heated and it's trying to cool our body off. So sweat comes out, gets on our skin. As it evaporates off the skin, it cools the surface of the skin. So it's 99% water, slightly acidic to prevent bacteria, and its main function is cool the body down. That's why when we have a fever and it breaks, you sweat really, really bad. When you're outside running in the heat, you sweat. Just going outside, if it starts getting hot, you start sweating because your body's like, hey, it's warm out here, let's cool off. There's a couple different types of sweat. So there's insensible perspiration, and this is the sweat that just like moistens your skin surface, and it doesn't produce wetness of the skin. You can't see it, but it is there. Then there's diaphoresis. This is when you can actually see somebody sweating. Okay, so this is wetness of the skin, and 1 liter per hour may be lost, and this is usually exercise or somebody's really sick and they're sweating really, really bad. That's diaphoresis. And there's cutaneous transportation. So this is water loss in the skin that is not sweating. So water diffuses between the keratin cells and evaporates from the skin surface. Okay, so it's not sweating, it's diffusion of water or osmosis between the cells, gets to the skin surface, and once it gets there, it's going to evaporate off. Okay, those other type of glands were sebaceous glands. We already talked about sweat glands. Let's talk about oil glands. So sebaceous glands are oil glands. They are flask-shaped, they have short ducts, and they open into hair follicles. Okay, so the thing that they produce is called sebum, and this is the oily secretion. It keeps skin and hair from getting dry and becoming brittle and breaking off. Okay, and this is when your hair gets greasy, it's because it's sebum. Your face gets oily, it's sebum. Okay, and then there's linoleum, which is a sheep sebum, and this is used in a lot of medications, specifically like body creams that are for dry areas. This is sheep sebum. We get it from sheep hair. So in addition to sebum, we also make cerumen, which is earwax. So it's a yellow waxy secretion that comes from the dead or it's mixed with dead epithelial cells, and it comes from within the ear. This thing keeps the eardrum pliable. It waterproofs the canal because remember, water and oil don't mix. It kills bacteria, so you don't get bacteria in your ear canal. And it also makes the guard hairs in your ear, the ones that keep all the debris out, it makes them sticky, so those foreign particles or the foreign bodies will stick to them as they're coming in, and they won't get in any further. Keeping the eardrum pliable is really important because it keeps the eardrum flexible, and if that drum can't move, we don't hear. There's ceruminous glands. These are coiled tubular glands, and they're all in the ear canal. We don't have them anywhere else. They're in the ear because the ear is the only place that makes earwax. Mammary glands. These are the glands in the breast that produce breast milk. They develop during pregnancy and lactation, and they only work during pregnancy and after pregnancy. If you continue to breastfeed or pump, they will continue to work, but if you stop for a few weeks, they will dry up and they won't work anymore. They are a modified apocrine gland, and they secrete everything through the nipple. Multiple ducts go into the nipple, like they funnel into the nipple, and that's where everything comes out. Most mammals have 2 rows of mammary glands. Humans have 2 breasts. Dogs have 2 rows of like 4 nipples. We only need 2 rows usually, but some animals have more, and that's called polythelia. But majority of mammals have 2. Humans, we have 2. As we're talking about skin, we need to talk about skin cancer as well. So skin cancer is really, really common, and it's mainly caused by exposure to the sun. It's common in places that are usually always exposed to the sun, such as the head, neck, and hands. It's common in fair-skinned people and also elderly people. It's really easily treated, and it's really common amongst all the types of cancer. And if you find it early, it has really high survival rates. It can either be treated or removed and cause no further issues. There are 3 types of skin cancer that happen in the epidermal cells, and these are basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. So basal cell carcinoma is the most common type of skin cancer. It's the least dangerous. It usually doesn't metastasize, meaning it doesn't spread. It just stays in the skin. It forms in the stratum basale of the epidermis, and it usually shows as like a small shiny bump that has a depression. It looks like a little crater, really, really red. This is basal cell carcinoma. Easy to treat if you catch it early enough. Usually doesn't cause many other issues besides the sores in the skin where the actual cancer is occurring. So squamous cell carcinoma happens in the keratinocytes or the keratin cells of the stratum spinosum. This usually happens on the scalp, ears, lips, back of hands. It's raised and reddened, and it kind of looks like an ulcer that's scabbing over. If you find it early, it's really easy to treat. It can metastasize, and if it does, it can become a problem, but that's usually if you ignore it. They usually show up as ulcer-like lesions on the skin, and you can tell you have a problem, and if you get treatment early, it's usually easy to take care of. So the last one is malignant melanoma. So the term malignant means cancerous or harmful. And melanoma would be cancer of the melanocyte, which is the color-causing part, the color-causing cell, basically, in your skin. So this happens in the melanocytes, the melanin cells, the cells that give you color. And it accounts for less than 5% of skin cancer. So this is pretty rare compared to the other 2. If you don't catch this one in time, it can metastasize and be fatal. It most commonly happens in men and redheads or people who are severely sunburned as a child. People with a family history of this are at more risk than people who don't have a family history. All of these types of skin cancers are common in elderly, and it's because when they were younger, they were outside all the time, and they didn't have the protection or the knowledge to protect their skin like we do now. They didn't wear sunscreen. They didn't wear hats. They didn't take care of their skin. So now they're having all these problems as they get older. Also, years and years and years of exposure just increases your risk. So as you get older, your skin has more damage from being in the sun for years. But specifically, our elderly now do not have the knowledge to take care of their skin the way we do and protect it from UV rays. The last thing we're going to talk about in regards to skin are burns. So burns are the leading cause of accidental death. So on top of, car accidents and ATV accidents, burns top all of that and how many people actually die from them a year. So burns can happen many different ways: fires, chemical spills, radiation burns, acids, electrical shock. It doesn't matter how it happens, it's all burns. And when you get burnt, you don't just die from burn. You can die from an infection in the burns. And you can also die from fluid loss. So when you are burned, you lose a ton of fluid. And you can only replace fluid so fast. So sometimes there's no ability to replace the lost fluid before the patient dies, because if you replace it too fast, it's fluid overload, but they're severely dehydrated and need the fluid. So it's a really, really complicated recovery for burn victims, and it's very, very fragile getting their fluid back. So most burn victims actually die because of fluid loss and not actually from burns themselves. And then there's this thing called eschar, which is the dead, burnt skin, and they can remove it by debriding it or scrubbing it off. And that's a really, really painful process. That can get infected or become toxic and cause a lot of complications in burn patients. So we all know that burns come in different degrees. There are 3 degrees: first, second, and third degree. And the degree is classified based on certain symptoms in the affected area. So a first degree burn is going to be the least tissue involvement and the least depth, basically, the most superficial. So it's going to involve just the top layer of skin, slight redness, pain, and slight edema or swelling. So a little bit of puffiness. Sunburn is a really good example of a first degree burn. Heals within a couple days. Just uncomfortable. It might make you itch when it's healing. It might cause your skin to peel. Second degree burn would be a partial thickness burn, which means it would involve the epidermis and a portion of the dermis. It can appear red, tan, or white, blistered, or painful, and usually can take 2 weeks to months to heal. And this may leave scars. Okay, so it's probably going to blister up. You're going to see more than just the very top layer of skin, so it might be deeper. It will take a long time to heal, and it will peel. The blister will have to scab over and heal. Third degree burn is a full thickness burn. So this involves the epidermis and the dermis, and it has gotten into or right at the edge of the fatty layer or the subcutaneous layer of your skin. This can affect everything in those layers, blood flow and everything. And often these don't heal on their own, and they need skin grafts because the skin is so damaged, the cells cannot repair themselves. So people that have third degree burns are going to need fluid replacements because of the severe loss of fluids, infection control because there's so much open wounds from the burns, and supplemental nutrition because they're going to need high protein to regenerate the tissue growth, and they're also going to need different electrolytes to replace that fluid loss. If people have been burnt in regions of their body that affect eating or breathing, there's going to be other complications. If you got burnt all in your face, you're not going to be able to eat. You're probably going to have a feeding tube. You might not be able to breathe. You might be intubated. You might have a trach. So there's a lot of other complications that can come with a third degree burn depending on the location of the body. And we talked about third degree burns needing skin grafts. So what a skin graft is when they take a piece of healthy, unburned skin and they basically transplant it into the area that has been burnt where the new tissue will not grow because of the damage. So you can get a skin graft from different places. You can get a skin graft from yourself. So they can take a chunk of skin from your leg to put it on your face if you got burned. It will heal up. The leg should heal because the tissue is healthy. And then by putting that new tissue on the burned area, it'll encourage it to grow new skin and heal. That would be an autograft. An autograft meaning it came from you. Auto is self. An isograft would be someone that is the same as you, because iso means same, which is a twin. So if you have an identical twin, you can get skin from them. It would be easy to get skin from them. They have the same DNA as you. Bodies are very, very similar. The only thing that could be different would be lifestyle differences because they share the same DNA. So an isograft is a good option. A homograft is from the same type, but not you. So meaning it comes from a human, so same type of species, but not you or a twin or a family member. It's pretty much an unrelated person. Heterograph means this is from a different species, and it's also called a xenograft. So you can get skin from like a cow or a pig and put it on a human, and if it works, it works. That's called a heterograph or a xenograft. Some other options include the amnion from childbirth and artificial skin from silicone and collagen. So amnion is the stuff that comes out of the amniotic fluid. You can use that to try and heal up the skin, basically like a stem cell situation. And then artificial skin from silicone is something that we are genetically making in a lab, which if we could get this made and we can, get it to where we can use it all the time and we can easily grow new skin in a lab, it would help with a lot of burn victims, because sometimes we can't do skin grafts because it's a huge area and we don't want to take the whole leg skin from somebody to repair their whole torso, or we don't want to take skin off somebody else's entire body to fix somebody's body. So if we could genetically grow skin or engineer it in a lab and perfect that process, this would probably help a lot of burn victims.